call vote will be taken for each motion to ensure that all members remain remotely connected during the meeting. With that, Danielle, if you'd like to do a roll call, please.
Melanie Beam.
Here.
Heather Campbell. Jennifer Demuth.
Here.
Ryan Dunn. Kelly Engelhardt.
Here.
Brian Kress.
Here.
Mark Murphy.
Here.
Jeff Neidig.
Here.
Marianne Audie.
Here.
Polly Peyton Miller.
Here.
Paul Rossi.
Paul, do you hear us?
Yeah, sorry.
Too many antibiotics. Julie Smith.
Here.
Maureen Stoneman. Okay, that's a quorum.
Okay. Board staff introduction.
Natalie Bolin, board staff.
Jill Sayer, board staff.
Danielle Lurie, board staff.
Veronica Spidel, board staff.
Michael Dotz, board staff.
Any guests? I'm hearing an echo. Is that me? Who's causing it, Mike?
I can't really tell. It's a pretty immediate echo, so I don't think it's the live stream.
Is it just when I'm talking or others? 'Cause I kind of heard it a few times, but not everybody.
They're not hearing it right now.
So yeah, I guess if you can stay muted, go ahead and stay that way until we get to the roll call votes for each of the activities. And then maybe remember to unmute yourself for the roll call. So are there any other guests on the call, Mike?
Sorry, no, I don't see any.
Okay. All right. First order of business is the approval of the agenda that everybody got mailed to them or emailed to them. Just need a motion and a second to approve the agenda.
This is Julie Smith. I'll motion to approve the agenda.
Mary Ann.
Kelly Engelhardt, I'll second.
Mary Ann,
Yes.
motion and a second. Any discussion? Okay, we'll do roll call on this, Danielle.
Yeah, Melanie Beam.
Yes.
Jennifer Demuth.
Yes.
Kelly Engelhardt.
Yes.
Brian Kress.
Yes.
Mark Murphy. Marianne Audie.
Yes.
I think I'm echoing. Polly Peyton Miller.
Yes.
Paul Rossi.
Yes.
I think everyone's echoing. Julie Smith.
Yes.
Motion carried.
Can I ask, my experience has been it's usually the phones that do the echoing. So I hate to ask, but Julie and Kelly, would you mind muting so we can see if that reduces the echo?
It's usually if you're on a phone alone or if you're on a phone for audio and computer for video is usually what we hear for echoes. And I think it's gone.
I'm
Breaking up, Julie. Okay, I think we're good. All right, let's move on.
sure. Sorry, I am on my computer and I have been muted except
Muted now on audio. All right, we're going to move on to the approval of the minutes everybody has from the June 17th meeting, pages 2 to 11 on your agenda. Again, after the review, is there any additions or corrections to the board meeting minutes from June 17? In pages 2 to 11. If
This
there's
is
no,
probably
extremely minor, but in all the votes, my name is spelled incorrectly, my last name. And it doesn't matter to me, but
That is not minor.
it's Beohm. So again, I don't take it personally, but
That is 125% my fault.
it's
I will
okay.
correct those.
Not a big deal. No
I
biggie.
can tell you if I mess it on the first one, it's gonna be in all of them because I copy and paste that
I
list.
understand. I totally understand. Thanks, you guys.
Noticed in the last half of the meeting, it looks like I didn't even vote on anything.
You had to leave early.
I did?
Yes, at 1:15, you got a call.
Yeah, there
Oh,
was.
yeah, we had a jail emergency. I remember that now. Thank you, Daniel.
Yep, so that was well done, Danielle, with Paul being there, and then he disappeared off the list, so you didn't cut and paste him all the way through.
No, I had to change it halfway.
All right, so is there any other corrections to the minutes from June 17th?
Just to let you know, I just admitted Ryan Dunn into the meeting.
Oh, thank you.
Apologies, had some technical issues.
Hey,
I was waiting for you.
good to see you, Ryan. So we'll take a motion and a second to approve the, and please state your name on, again, on all of these, so we know who's talking, on the board meeting approval of the minutes.
Hi,
I'll
this is
listen to approve.
Jennifer. I make a motion to approve the minutes as corrected.
And this is Melanie. I'll second that.
A motion and a second. Any other discussion? Okay, Danielle, roll call vote, please, for approval of the minutes.
Melanie Beam,
Yes.
Heather no, Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Kelly Engelhardt,
Aye.
Brian Kress,
Aye.
Mark Murphy,
Yes.
Marion Audie,
Aye.
Polly Peyton Miller,
Abstain.
Julie Smith, Julie, was that in? Motion.
Okay, thanks, everybody. Last,
Kelly, I think it's most definitely your phone. Yeah. Thank you, Kelly.
Oh, okay, thank you.
okay, great, Echo's gone. The last item, 1F, is committee appointments with the changeover of the board chair and vice chair and other committee needs. We do have a few committee appointments to make, and I'll make here at this meeting. And they are, first of all, Julie Smith is being appointed to the budget, and also as board or as budget committee chairperson. So thank you, Julie, for that commitment of time and energy. So budget committee member and chairperson, Julie Smith. And also Julie Smith will be a member of the, appointing her to the member of the Tri-P committee. So that would be Maureen's committee, as I'm not mistaken. So that would be in addition to your committee. The Tri-P would be Julie. So thank you, Julie. So those appointments are done. Anything else under committee appointments? Did I miss, Natalie, or we're still good to go with what we talked about?
We're good to go.
Okay. All right, next is budget committee, which we have several action items under there to do. We did not have a budget committee meeting today. I'll leave it up to board staff and Julie to figure out if we're going to have budget committee meetings going forward with the new format, and let me know what goes on with that. But so I'll go through the budget committee items that are on the agenda. So first of all, Michelle, if you could go over item A, the then and now on page 12, and explain what's going on there. Are you there, Michelle? Muted, unmuted.
I was not, you didn't hear me? I was just going. Okay.
I'm glad we didn't hear that. No.
These are two expenses that didn't have purchase orders or a sufficient amount of purchase order remaining to cover their balances. I didn't realize the JCA was going to be quite as high as it was, but that is actually for Tuscarawas and Carroll County path units for the full fiscal year, including utilities and furnishings and things like that. So therefore, I need to get those approved because they were processed in July outside of board meeting. I just needed them to be adopted today.
Jeff, I'll make a motion to approve the then and now certifications as requested on the
This is
board
Ryan.
doc.
I'll second.
Second.
And is that for both of those, Julie?
Yes, for both of the items,
Okay.
10097 and 10098.
Okay. So approval to, for those paying this POs. Any other discussion? Danielle, could you do a roll call vote then, please?
Melanie Beam,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Kelly Engelhardt,
Aye.
Brian Kress,
Aye.
Mark Murphy,
Yes.
Marion Audie,
Aye.
Polly Peyton Miller,
Yes.
Paul Rossi,
Yes.
Julie Smith.
Yes.
Motion carried.
Okay. Next would be expenditures for July, pages 13 and 14, totaling $326,718.24. And did we, yeah, there's the asterisk. So if you look at the asterisk in the middle column, those are 2021 expenditures, and there's still some 2020s there for the fiscal year. Any questions direct into Michelle, or Michelle, if you have any critical highlights to mention to us?
Probably the biggest highlight would be the auditor of the state. Halfway down the page, it's 881 audit. I just want to touch on our audit because after the audit was started, they realized that we needed to have two major programs audited, not just our one alcohol and drug federal program. So they decided to audit the HUD program in addition to that. In doing that, that increases their cost. So they sent us a amendment to our agreement of the cost. The original cost was $9,717, and they want to increase it by $1,517 because of the extra time it took to do the HUD portion of the audit. So the new total would be $11,234. We still are within our budget. We're fine with that. It's just that there was more work to be done than they had anticipated.
Michelle, when they've done our audit in past years, how do they come into the audit process this year and not realize what programs we have?
I think it probably was based on, I don't know if it was based on the amount of federal dollars we have received, that they had to do an additional major. I don't know. I mean, they had my federal schedule in advance, so I'm not sure where the slip up happened, but she did spend a significant amount of time on the HUD program. She's been very, very thorough.
Any questions on the July list of bills for Michelle? Again, moving forward, we'll possibly have this reviewed by the budget committee ahead of time, so we'll even go through it faster. All right, if there's no other discussion, need a motion and a second for approval of the July 15th list.
This is Julie Smith.
So Julie made a motion. Anybody second?
This is Paul. I'll make
This is
second.
Kelly.
All right, did you get that, Danielle?
I have about 6 motions. We're good.
Okay. I think Kelly and Julie both were on it.
Kelly, I'm gonna give you one, I promise.
All right, no problem.
All right. Danielle, roll call vote, please.
Melanie Beam,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Kelly Engelhardt,
Aye.
Brian Kress,
Aye.
Mark Murphy, Marion Audie,
Aye.
Polly Peyton Miller,
Aye.
Paul Rossi,
Aye.
Julie Smith.
Yes.
Okay, motion carried.
Thank you, everyone. The next would be the August list of bills, August 19th through today. Still having some 2020 expenses on there. Total $295, $858, and 37 cents. Any questions or discussion on the list of bills for August? Or any highlights from Michelle? Or any out?
Just a couple quick highlights. 723, 3/4 of the way down the first page, page 15, you'll see Geisler IT services. That's an annual expense, so that's not something that you see frequently. That is the software license renewal. Two other things on the very last 2 things on the second page, well, page 16. These are happy things. Not that the other things aren't happy things, but the Joe Audie Memorial Fund is donating $1,000 to the Buckeye Career Center Drug Free Club, even though I spelled club wrong. And the Into the Walk Survivors of Suicide assigned 2 $500 scholarships, or awarded two $500 scholarships to 2 students that are headed to Kent State and Akron University. That's it.
Any other questions or any questions for Michelle?
I have a question. The NAMI expense, is that something we pay annually? What does that cover exactly?
Actually, you're correct. I should have highlighted that one too. NAMI is an expense that we have a contract in place for fiscal year 20. The agency had not submitted billings that were itemized. They were submitting, requesting quarters, 1 quarter at a time. So we finally actually got the signed contract back, and we actually got this invoice that has more detail. So we felt we could pay it. The total award was $10,000, so they're clearly under it. If we would have paid them quarterly, it would have been more than necessary. But we do have a contract with them in place for 21. And as you know, in board meeting, we specified that it wouldn't be, it would be more of a reimbursement. It would not be here's a quarter, here's a quarter, here's a quarter. So
Okay,
that's where that is.
thank you.
You're welcome.
Any other questions? Okay, if there's no other, then we'll entertain a motion in a second for the approval of list of bills for August through the 19th.
This is Ryan Dunn. I motion for acceptance.
This is Brian Kress. I'll second.
Thank you. Further discussion? Danielle, roll call, please.
Melanie Beam,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Kelly Engelhardt,
Aye.
Brian Kress,
Aye.
Mark Murphy, Marion Audie,
Aye.
Polly Peyton Miller,
Aye.
Paul Rossi,
Aye.
Julie Smith.
Yes.
Motion carried.
Thank you. Item D under budget committee is the financial statements. We're still on last fiscal year. These are statements ending June 30th. Any comments on those, Michelle, before we get into any other open discussion?
Well, these have any fiscal year 20 expenses to date have been included on this as well. So anything we paid in July and August has also been factored into these figures. You're probably going to be happy by the looks of the revenue, because state-wise, we've gotten all of our revenue. The only thing that we don't have all of our revenue in are things that are typically reimbursement. So unless the service is provided, we don't apply for the money. So that's why you can see after we get out of the bulk of the state, it changes a little bit. But like I said, it's reimbursement for services. So if it's been done, it would be drawn down. The next page is just the revenue and expense. We did on page 19 on the board budget. You can see under building expenses, we did exceed our budget by $157. And that was related to utilities. They were higher than anticipated. So I don't know if you want to do a line item transfer now. I don't think there'll be any additional expenses to the board budget, or if, because I'm not over, if you just want me to adjust it so that it's balanced within the budget, I can do whatever your pleasure is.
Michelle, if you just would balance it within the budget, I don't know if a line item transfer is not necessary. If you just want to balance it within the budget, I think that would be easier if no one has any concerns.
Yes, because we're still well within our range.
Correct.
Okay, I can do that. After that, you'll see the page 20 is the balance sheet. And just our cash position. Now this is through June 2020. So we do have receivables going towards 2020 that we've received in July. So that's why you'll see that 47. There will be more. It's just that I'm not positive of the amount, so I usually wait to post them. And then they'll be, reposted to the 2021 ledger as well too. But if you have any questions, I can talk about that.
Any questions from anyone on the balance sheet or the statement of revenue and expenses? If not, we'll take a motion and a second to approve financial statements ending June 30th as we have them presented by Michelle.
Mark Murphy, so moved.
This is Ryan Dunn, I second.
Thank you. Further discussion on the motion? All right, Danielle, roll call, please.
Melanie Beam,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Kelly Engelhardt,
Aye.
Brian Kress,
Aye.
Mark Murphy,
Aye.
Marianne Audie,
Aye.
Polly Peyton Miller,
Yes.
Paul Rossi,
Aye.
Julie Smith.
Yes.
Okay, motion carried.
Thank you, everybody. Last item is a contract amendment for fiscal year 20 from Ohio Guidestones. Who has that, Natalie or Michelle?
I think we can tag team it, but I'll give you the general overview.
Okay.
We created a budget last fiscal year in FY20 for PFCS to fund their recovery house. That amount was partially based on carryover and partially based on the money we were allocated for 20. And it had been typical for the past year or two, that amount. What the state has decided to do this year is they weren't necessarily your allocation for 21 would be reduced by the amount that you carried over. So instead of carrying over money into 21 and reducing our 21 allocation, PFCS's expenses went through the roof at the end of the year during the pandemic because they had to pay staff overtime because they couldn't get staff in or the staff was on medical leave. So they paid staff overtime and ended up needing that additional money. So the expenses were there to justify the additional amount, and it also protected our FY21 allocation. Michelle, is that a fair summary?
Actually, we did have about 7,000 in carryover. But that carryover we will not lose it. We get to keep that carryover. And if we are going to use that carryover by December, we will be able to get our full first quarter allocation returned to us.
Thanks for the clarification.
Sorry.
No, that's good. And then Jeff, do you want to talk about the exact amount?
Well, we need to take board action, I see. So I think we need a little bit more details, yes.
Yeah, Michelle, go ahead.
Okay, the original contract with personal family counseling services for recovery housing was $84,186. They clearly were on a roll because they billed an additional $23,974.23. So that's what we were requesting the amendment to increase it to $108,160.23. Part of the reason for their increase was they had some personnel. They were short on some personnel, and there was an individual who was pretty much working almost around the clock. So that kind of drove up the cost of fringes, salaries and fringes. So that's the big part of it. I know they're planning on trying to do things a little differently. In 21, they have requested the 84,186 again. So see what happens.
So you guys are comfortable in the Adams Board office with a $20,000 increase for overtime coverage primarily?
I don't know that it's all overtime.
Okay.
I mean, that's just one of the factors that increased it. They had to purchase some additional things for within the house, things need replaced, oven or stove, refrigerator, a couple things like that. So they had some larger expenses too.
And the other thing about this is money that the state has assigned only for recovery house. So it's not something that could be used in any different program. It was a use it for your recovery house or, potentially return to the state.
Yeah. So the money's there. It's just we need to adjust the budget based on their new needs. Okay.
Correct.
Any questions for Michelle or Natalie on the contract amendment for Ohio Guidestones Recovery House? If not, we'll entertain a motion for approving that contract amendment.
This is Mary Ann, so moved.
Brian Krass.
This is Kelly, I second.
So Mary Ann and Brian, any other discussion on the motion? Okay, Danielle, roll call, please. The vote.
Melanie Beam,
Aye.
Jennifer Demuth,
Aye.
Ryan Dunn,
Aye.
Kelly Engelhardt, Brian Kress,
Aye.
Mark Murphy,
Aye.
Marion Audie,
Aye.
Polly Peyton Miller. Kelly, do you want me to call your name again?
What?
Paul Rossi,
Aye.
Julie Smith.
Aye.
Okay, motion carried.
Thank you, everyone. All right. That's everything that was on the agenda for Budget Committee. So we'll move on to number 3 on the agenda, Public Relations Committee, and we'll turn it over to Brian.
Thanks, Jeff. Monday of this week, we had a meeting, which you see the minutes, so I won't get into a bunch of detail, I guess, but some of the overlying things basically is our language approval is now in place with the commissioners, and that now goes on for further approvals. We're looking end of August, early September to get our ballot number. And that way we can start to utilize that as well. We talked absentee ballots, things of that nature. Those go out October 6th, I believe. We are timing our flyers and mailers and such to go out at that same time as well. So that arrives at the homes when the absentee ballots start to arrive as well. Many things on media that we're doing with podcasts, Facebook boosts. The billboards are purchased and ready. Things of that nature. Natalie was interviewed recently for a Times Reporter article that'll be going out soon as well. So a lot of media is starting to happen. Campaign slogan was decided upon. So we ended up deciding to utilize the board slogan as well for the ADAMHS board, the overall slogan. So that's going to fit nicely, I believe. And then, got into a little bit of design work on, what some of our flyers look like and things of that nature. So good meeting overall, I think. We seem to be well on track. Yeah, thank you, Mike. That's what we decided on for our postcard style mailer. The issue number is just made up at this point. We don't have this year's, but short, concise, it's got our ADAMHS board name. It's got the issue number. It's clearly telling you to vote yes. So we discussed colors and everything that seemed to fit based on, viewing these and such as well, if they go on to yard signs and things of that nature. So good shape on timing. I think we're plugging along nicely at this stage. Anybody have any questions for us? If none, I'll turn it back to you, Jeff.
Great, thank you. Yeah, really good meetings they're having, really good discussion, pulling from everybody's experience with public relations, marketing, levies. It's really good discussion. So I appreciate everybody's work on that committee, doing some really good stuff. Board staff included, really good stuff going on there. So thanks, Brian, for bringing that all together and keeping those meetings going and keeping them scheduled and adjusting to everybody's new meeting norm, meeting or not meeting. So appreciate that.
You're welcome.
Great. So let's move on to director's report. Item number 4 on the agenda. Natalie, what's going on?
So the first item on the agenda is the health officer. And as you will recall, we talked about the only time we typically review these is annually for renewals or replacements. Health officers are designated by the board to involuntarily hospitalize individuals in a psychiatric emergency. And so years back, we developed a policy and reviewed the policy to allow someone to apply for health officer status. Veronica manages this now. I'm going to hand this off to her.
I'm sorry, my internet's quite unstable right now. I'm not sure what the problem is. So if I go in and out, that is why. I am requesting approval for the following applicants. Krista McCauley for provisional status of health officer. And also for Star Jones, she would be a renewal. If you'll remember a couple of months ago, these were 2 individuals. I was still waiting on a background check for Kristen and hers came back and it was fine. And I was waiting on Star Jones's CEUs. So we had to do an extension for 2 months for these individuals. Even though we would be approving them later than the others, their designation would still expire at the same time in 2 years on June 30th of 2022. That's all I have right now.
Okay. Just a point of information request I have is if, so these individuals are working within different organizations. So basically an individual I'm thinking of Paul, you know, how he interacts with the community and sees somebody, or so you have to find one of these individuals in order to get them involuntarily moved to an inpatient secure setting. Is that right? So how do people know where these health officers are at?
So the only individuals that the board is charged with authorizing are individuals connected to our system.
Okay,
Law
gotcha.
enforcement, physicians, they all already have that health officer status to involuntarily hospitalize.
Okay, okay. All right, so this is something we need to take action on. Is there any other discussion or questions for Veronica related to the approval of these two health officers? If not, we'll entertain a motion and a second for approval of Kristen McCauley and Star Jones.
Brian Kress, I'll make that motion.
Thank you, Brian.
This is Ryan Dunn. I'll second.
Brian and Ryan. Thank you very much. Any other further discussion on the motion? All right, Danielle, can you do a roll call vote, please?
Melanie Bean,
Aye.
Jennifer Demuth. Did I hear yes? I'm sorry, Jennifer. Okay. Ryan Dunn,
Aye.
Kelly Engelhardt.
Yes.
Okay. Brian Kress,
Aye.
Mark Murphy,
Aye.
Marianne Audie.
Aye.
Polly Peyton Miller,
Aye.
Paul Rossi,
I think I should probably abstain because I might end up working with those individuals.
and Julie Smith.
Aye.
Motion carried.
Thank you, everyone. Appreciate that. Natalie, you got the other items?
Yes, opiate overdoses. So we had, and Mike, if you wouldn't mind doing full screen, I just like to see everybody's faces since there's no more. Thank you. We had really ramped up at the beginning of the pandemic for what we had thought was going to be an increase in suicides, and we did a lot of outreach and information and education. We expected an increase in overdoses, but not nearly to the extent that we've seen. We are moving back toward our 2017 level of overdoses and overdose deaths. We have incredibly increased the meeting of our opiate task force and have a lot of activities planned over the next couple weeks and months. And I'm going to speak a little bit about our silhouettes and ask Marianne to chime in as well, because she's a very active member on the subcommittee, and Veronica as well. We are doing silhouettes similar to the ones that we used in our levy in the past. And there will be a black silhouette indicating the number of individuals that died from an overdose, a gray silhouette indicating those that overdosed but did not pass, and then a yellow silhouette, which will have Project Dawn information or support information or local services. We're planning to have those silhouettes in the cities where the overdoses occurred. So our subcommittee is reaching out to mayors and leadership in the cities to make sure that's okay. At the end of, I believe, October is what we're looking at. We're trying to get all of those silhouettes in the square in downtown Philly. And one evening that last week of October, or Marianne, it might have been the third week. That third week in October, we're going to do an event, and it's going to be a live streamed event, not to prevent people from, gathering, but just an event about the overdoses and support services available. That's a very brief overview. Marianne, do you have anything you'd add to that?
Just to reiterate, the 3 colored silhouettes will be in the communities for 2.5, 3 weeks, and then brought to hopefully the county courthouse for the main event.
We're also doing a panel discussion. We have a handful of people that have agreed to be on a panel. We're going to do that live as well. For those of you who were around for the Bearing the Weight of the Loved One's Addiction event, this is really going to be a similar format where the community just gets to ask questions. and our system, law enforcement, family members, providers, peers, will answer the questions and hopefully provide some good feedback to our community. So we're doing what we can. It's interesting. The numbers are 17 deaths in the first 6 months and 127 overdoses. Those are not individuals. Some individuals have overdosed repeatedly, but independent EMS 911 cases is 127 the first 6 months of this year.
Natalie, can you mention, I think you shared this the other day with our PR committee. How are those numbers comparing to a year ago?
They were significantly lower a year ago. We had seen a decline since 2017. And I think we still would have seen a decline if we weren't stuck in a pandemic. The people had tended to back away from virtual groups and virtual counseling. The social interaction was not there. They stopped services, and this is where we landed.
Yeah. Well, thank you to you and Marianne and whoever, everybody that's involved in it. I just think that the silhouette concept is powerful and sombering, yet just incredibly meaningful for lives represented. So I just thank you very much.
Very welcome. Thank you.
I would concur, Natalie. That's very sobering to hear those numbers.
I think 17 year to date, and wasn't it 11 all of last year, if I'm not mistaken, from, because Jody shared me those stats from the coroner.
And you know what, I have it, I just had it pulled up in my email. Let me see if I can get to that again quickly. Yeah, we had, like I said, we had seen a beautiful decline, and here we are. So the coroner's office sent me a spreadsheet, and these are deaths. They don't have the, Wes Halter would have the overdoses, but deaths in 2019 was 13. In 2018, it was 9. And in 2017, it was 23. And the first 6 months.
This is 6 months.
Go ahead, Kelly.
I was just wondering, the data you're talking about is just for Tuscarawas County, correct?
It is. I had the data that I'm receiving for Carroll is indicating your numbers are incredibly low, incredibly low.
So they're probably not accurate.
Are you hearing something different?
No, I just think that there's probably more out there than actually is being reported, and probably because of our EMS system being fragmented as it is, that's probably not reporting as it should. Melanie, anybody else have any other thoughts on that?
Sorry, I was shaking my head. Yes, I forget that you might not see video. Yeah, I find that difficult to believe. Is there any way we can reach out to our EMS to see if we're getting accurate numbers, or that's just what we're getting reported?
So I had connected with an individual at the sheriff's office who was letting me know if there was a suicide attempt or an overdose attempt. I'm going to check with her and just make sure I'm still on her list to communicate with. I had also worked with at the sheriff's office, I forget his name, tall gentleman. Anyway, I can't remember his name. It's in my email, but data collection has always been a difficult issue. And it took us a long time to get someone to buy in to gathering Tusk data. And it's just taking a little bit longer in Carroll. But we do need to have somebody on the inside that believes in our mission and is willing to work within that system to help us gather that information. Kyle Courtright?
Kyle Trisnar?
Yeah.
He's one of our detectives.
Sheriff's office, right?
Yeah.
Yeah.
Is there anything we can do to help with that, us folks out here in Carroll County?
You know, my outreach has been to the sheriff's office and 911. If you feel like it's better to connect with MS, if you can give me some information, will reach out.
Let me get you a contact for the EMS person. I think. What do you think, Kelly? I think we could at least start with Mr. Joseph because he's our primary EMS provider in the county.
Okay.
I know we have a couple other providers that we end up reaching out to, and maybe 911 could help with that. But I can get you a couple contacts, and I would support that in any way that I can as far as expressing the need to have a better data collection process. For sure. Because I find it difficult to think that our numbers are that low or non-existent.
Some of the lowest in the state.
Yeah, I live out here. There's no way. Sorry. Yeah, and maybe it is a really good thing, but I'd like to be sure.
Let's just make sure. Mike, can you check Kelly's chat in the box, please? Yes.
Natalie,
Go
Now
ahead.
she's muted though. She's muted now though.
She can't unmute. Go ahead, Julie.
Oh, she can't
Could you-
unmute. Okay.
could you repeat the number of deaths for the last 6 months?
Yes, we have had 17 deaths the first 6 months of 2020.
Thank you.
I think that'd be a great project if, whether it's Adam's board takes it on or whoever, to get those health places or the EMS or whoever, sheriffs, because there's obviously no hospital up there to be collecting the data, or I'm not sure even what the coroner's office is up there. But if we could get those numbers and those statistics for that and probably some other things, that'd be a great way to, organize some things going on up there to get, especially for these statistics for the Adams board, and really for the Frank that works with the Anti-Drug Coalition equivalent up in Carroll County. So that'd be great if we could get some connections going up there, see how willing they are to work together. And that's probably been, there's probably some history that Kelly and or Melanie could to shed light on. But yeah, that'll be great to work on getting some new statistics for Carroll County, so we can obviously have some input on, is there anything the Adams board could help up in that area? All right.
This is Kelly. Can you guys hear me now?
Yes.
Yep.
There. Now my computer's unmuted me. I think as public health will also, we have a tobacco vaping cessation grant, but I think that we can tie that in to look at and try to partner with some of those partners for trying to obtain that data. They have to run reports. It'd be nice if we could get that just even from the state, because sometimes it's easier to do that than it is to get it from the locals, especially when they're busy during a pandemic. So, but we're working on it here.
Thank
Great. And Kelly, you are not echoing right now. So if you want to stay, no, I'm sorry, you are echoing now. Everybody else echoes when you're not unmuted. So sorry. There we go. All right, Natalie, next.
Okay, let's do a quick update on our crisis services. I have been meeting with the clinic and both their local staff as well as their central intake at their Lutheran hospital. One of the things that we're doing is we're moving in a little bit of a different direction than purchasing a crisis service from them. They are not certified to provide that specific service, but they're going to provide it regardless of the board paying for it. Our only bump is that we can't give board dollars to a service that's not OMOS certified. They can still provide it. We just can't give them money for it. So since they're going to provide the service regardless, we were looking at what fundamentally are we reimbursing? And what we're really reimbursing is not necessarily that crisis assessment, but it's that central intake function of connecting the individual to the hospital, placing the individual with the hospital and then discharging them back. We are looking at how to make that happen, but even more important than that, if they're going to be working with any of our individuals, we want to make sure that we're getting all of the data that we need for tracking purposes. We've been working with an attorney through the board association at the state who it is very familiar with all the rules, regulations, and guidance related to these kind of non-traditional funds. And she's given us a lot of good guidance and an agreement that is going to work well for this process. It's funny, when we began this, I consulted with a couple of ADAMHS boards and a couple of hospitals who are doing this. And when I let them know how this was working out, and that the attorney was diving into it, and this is the feedback she was giving me, all of a sudden everybody stopped calling me back because their system is working well and it's working beautifully, and you know, not everybody wants to approach it differently. So we're just making sure that we're doing our due diligence and this is being handled as correctly as possible. We're still moving forward with the clinic. CMH is beginning a soft rollout of their mobile crisis. They have done a meeting with New Philly Chief, Dover Chief, and Orvis. And they're just going to start locally so we can work out some bumps closer to the hospital before we roll that out statewide, across both counties. And that soft rollout is scheduled to happen September 8th. What questions do you have for me about crisis? Thanks, Ryan. Okay, do you want me to go on, Jeff?
Yep,
Natalie,
yes.
Sorry, I do have one. I just want to clarify something. I couldn't figure out if I was muted. So with Cleveland Clinic, we approved a contract for them, I think for the $20,000. So that's not going to be used for assessments, so to speak, but we are trying to work out a contract to pay them instead for the facilitating placement and coming up like with a discharge plan back to our community. Is that what I understood?
Correct. That navigation portion of people placed through the hospital.
Okay, thanks.
Wasn't it a staff position in the budget? They talked about a staff position.
Correct.
Okay.
Do you foresee that the $20,000 that we allocated will that be adequate for the service that we're talking about?
You know, I have to tell you, when I met with the clinic staff from North, they were very, very good clinicians with their heart in the right place. And these are my words, but not her words. Basically, our $20,000 contract isn't going to make or break this relationship, and they're going to do what needs to be done to get clients the services that they need, honestly, regardless if we were able to contract with them or not. The good thing about the contract is that it ensures that we're getting data for our residents that are hospitalized. And it ensures that I'm comfortable identifying some of their staff as health officers if we have more of a contractual relationship in place.
Okay, thanks.
And Danielle, you've been a part of these conversations. Is there anything you'd add?
I don't think so. It's still a work in progress, that's for sure. But once we get where we need to be, I think we may actually have more data at our fingertips than previously. So,
thank you. Jeff, do you want me to move on?
Please do.
We are looking at a return to the office the Tuesday after Labor Day, which I believe is the 8th. I think I'm going to phase us in for just a couple of weeks just to make sure that we have bodies in the office, but we're also maintaining distance and safety. And then as long as Danielle and I are working, especially Danielle, let's be fair, are working on making sure that we're dotting our I's and crossing our T's, connected to the governor's guidance on workplace safety. That's just Danielle's strength. She's very much germaphobe, and we are putting it to use right now. But yeah, so we are going to be coming back in the office, and I would see us staying unless something happened in the county, return to a higher exposure level, which Jen, I'm sure, shares with us and will share with us. Do you have any questions about that?
Natalie, I do. This is Brian. That is our next scheduled PR meeting as well. Do you want to keep that remote and not overwhelm your first day back?
So what I would like to do, and if you have any different thoughts, please let me know. I still would like to continue to meet virtually, as long as we're able to, and as long as the state permits us to. I really don't want groups in here, whether it's support groups or any kind of groups, if we can hold that off right now.
Agree. Thanks. Just wanted to ask.
Thanks, Brian. And then Marianne, did I see?
Okay. What was the date, did you say?
The 8th.
Okay.
Yes, the day after Labor Day.
Thank you.
You're welcome.
This is Jennifer. I just wanted to say, if the case numbers would start to rise locally, you may want to consider staggering. Like, some employers are doing, 3 days in person and 2 days virtually, just like the schools are planning. So that might be something to kind of have, as a backup plan in your pocket if, our county level would go up to a level 2 or a level 3 again. And then you can stagger who's in the office certain days, so you don't have too many in the office on any particular day. So just something to think about. Also, as you're there in the office and getting used to all being together again, Danielle, if you're kind of taking the lead as safety officer, if you have questions or need help in interpreting the data from the state and the state's order, we're here at the health department and can help you out. Feel free to reach out to me. I've had many businesses contact us and me personally in the past several months, so I'm happy to help.
Thank you, Jen. Jen, is the county expecting a surge when the kids return to school?
Well, we're cautiously optimistic, right, Mark? Yeah.
Thank you.
That is the phrase I use all the time.
Yeah.
We're cautiously optimistic and trying to continue planning and moving forward.
Yes.
Thank you both. The next item is board member vacancy. While I was on vacation, Shane Camben called me and he declined board membership. This is what I typically find with people in recovery is their heart is really to get out there and be boots on the ground, helping one-on-one with people that are struggling. And sometimes it's hard to find someone who's interested in that kind of higher level financial governmental overview. Veronica did toss out a name to me and I asked her to reach back and see if he would be interested in talking to me. He is. So that is my next contact to see if he would be interested in potential board membership. And hopefully he and I will have that answer by the September board, at least his interest by the September board meeting. Okay. And any questions? The last on the director's report is the community plan. Typically, this OMAS, the state requires boards to submit a community plan every 2 years. Under the old OMAS director, they hadn't done it for a little while. And so last year we did that year and the prior year. What is due now is this year and then the next calendar year. So prior to our next board meeting, and I will get it out to you as quickly as I can to make sure you have time to review it, you will be getting another large document community plan. The community plan is our contract with the state saying, this is what our needs are, this is what our programming is, and this is what we would like to do in the future. The state then reviews it and they approve it or disapprove it, and give us some feedback. So I just wanted to give you a heads up that this document will be coming your way and we will need to approve it at the September board meeting.
Okay.
That's
Any questions for Natalie on any of her items, especially the last one there? All right, thank you, Natalie. Next is item 5, COVID-19 impact and updates. Natalie?
The agencies are all providing services that they had historically. They're just providing some of them a little bit differently. For example, they're still out in the community doing case management, transporting less. And when they are transporting, the agencies have given their staff guidance about how to safely transport as possible. Some of the agencies are really doing some great things. Like I spoke to ACE, and what they are doing is they have a limited schedule right now where their doors are open daily from 10 to 12:30. After that, they have a virtual activity online from 1:30 to 2:30. So there's still that constant option of connection without there being a lot of face-to-face time. One of the things that they did that was very successful was they do lunches every day. They did lunches every day for their attendees, and they are doing to-go lunches now or delivering lunches. So I thought that was really great that ACE is doing everything they can to still provide support to our community. I believe I had a meeting that Mandy Prosser was in this week, and she said that the CAC has temporarily shut down. They're waiting on someone's results of their COVID test prior to opening the facility up again. So that's another programmatic impact. You know, I had talked with Ryan Dunn this week, and he had asked some questions about stats, and I have some, but especially since Ryan's gone, I think I'm going to wait and ask Mike to gather. Our stats went through the end of May. I think I'm going to ask Mike to gather stats through the end of August so we can take another look at how COVID has impacted our services, revenue, face-to-face contact. Is everyone okay with that? The fiscal impact, Michelle, I don't know if you have anything you want to say as well. We're still looking at how the end of fiscal year 20 impacted our agency's revenue. They're doing everything they can to still get their billings up, but there was a brief period of time whenever their attendance has decreased significantly. We have done a lot of outreach for grant support. We have a grant funding for crisis stabilization unit, which really targets outreach to our healthcare workers and includes tracking how many healthcare workers are getting admitted to the CSU. The statewide goal for that is 10% of CSU admits. We're at about 9.2 across the state, but that's a grant funding that we receive related to COVID. And we are also waiting on the federal government to award COVID funding as well. And the COVID funding that we applied for as a board is outreach, increasing the community awareness of our supportive services, stigma reduction, and mental health awareness. So we had to submit itemized grant proposal, and we're still just waiting to hear on approval of that. Michelle, is there anything that you would add regarding fiscal? She's shaking her head no.
I think you covered it well.
Okay, thanks. And lastly is the other section, and we've been working with any schools who have reached out to us regarding support that we can provide. I went to New Philly schools yesterday and did a presentation about our local resources, and I always include the ACEs information in that presentation about the adverse childhood experiences and how increased trauma impacts health, mortality, and then obviously risky behaviors. So not only is that a great way to partner with the board to get back to school, but it also is an opportunity for me to share ADAMHS and our logo with all the school personnel. So We have the article coming out in the TR, and other than that's the biggest other that I had on my list right now. Jeff, do you have any other questions?
Any others? No, I'd asked Natalie to put this on there because obviously it's a top of mind awareness right now, COVID. So if any board members has any questions, concerns, things that we need to talk about related to COVID, questions related to COVID, feedback to the board staff, and we'll get that under this part of the agenda. Obviously, there's other parts that will dwindle into COVID just because of the nature of the standard agenda, but anything else, just an update on grant funding, additional requests, lag in billing from other of our contracted services. So anything like that will go under this. And then as soon as Jennifer gets COVID out of the community, we can take it off the agenda. No, it's going to be around for a while. So we just wanted to have a kind of a place to put all those kind of things and any questions or concerns that, because we know that not only from the overdose deaths, but just increase in mental health use of different levels and different facets that COVID is having an impact. We just need to see where Adams Board can use our resources to improve that, make it better, or address any concerns. So if you have anything in your neck of the woods, certainly share it with Natalie so we can get it on the agenda or between agendas to be addressed. Anybody have anything else to add under COVID on the impact and how the Adams Board can address it?
Natalie, you mentioned that there will be an article in the TR.
Correct.
Will you send something out to us when that's going to be published or when it is published? I'm not a regular newspaper reader, but I will pick up a copy to look at when I know it's in there.
And I just want to be clear, the article in the TR is a series of 3, and John Baker from the TR asked to do a back to school series. And so Michelle Grimm from Dover, Lindsay Tidrick from Strasbourg, and I met with John Baker, and we are one of the series of 3 articles. Absolutely, I will send it out to the board. And if you are willing to share it to any of your professional pages or personal Facebook pages, again, everything we can do right now to keep Adams in everyone's mind is potentially another positive vote at levy time. Jeff, that's all I had.
Okay. Do we have any unfinished business? Board staff know of anything? Julie, do you remember anything else unfinished that we need to address today?
Not that I can recall.
No, Danielle would have done a great job of including it on the agenda.
Yep.
I just want to thank Natalie for being on top of things the way she is. I appreciate your expertise.
Thank you, Polly.
Absolutely. All right, new business. We have upcoming meetings. Next board meeting is September 16th as regularly scheduled. And the PR committee, as Brian mentioned, is September the 8th. Tri-P is to be determined. Danielle will send out all that to those individuals to let them know when that's going to be rescheduled. Any other new business? No? Silence. All right, well, we'll entertain a motion for adjournment and then we can get back to your other business.
I move to adjourn.
Okay. We are adjourned.